Welcome to the Health on Track podcast. Let's talk well-being.
Welcome to the Health on Track podcast, offering you a shot of wellness. I'm Yasmin, and I'm the Member Engagement and Communications Manager at GIG Gulf Insurance. Anytime you're browsing social media, I'm sure you've come across all these new products and trends for skincare. Suddenly, everyone is an expert and everyone is telling you about some product that changed their lives. We're here today with Dr. Maya Khoury to put an end to all the hearsay and to give you the ultimate guide to taking care of your skin. Dr. Maya is a specialist dermatologist with Mediclinic Dubai Hills and Mediclinic Parkview Hospital. She has multiple years of experience treating skin conditions, nail and hair disorders, as well as cosmetic dermatology. Thank you so much, Dr. Maya, for being here with us today.
Thank you for having me, Yasmin.
So why don't you start by telling us, what would you say are the most important items for skincare?
So for me, 3 items are very important in your skincare routine and that you cannot miss. So first you have the cleanser. So cleansing is very important because it removes the dirt and the excess oil on your skin, and it prepares your skin for the other products to be absorbed. So for example, if you have oily skin, you can choose a foaming or a gel cleanser that contains salicylic acid or glycolic acid. But if you have dry skin, you have to choose a gentle, non-foaming one. The second item, the second most important item is a moisturizer. So whether you have oily skin or dry skin, you have to hydrate your skin because it prevents dehydration, it gives you a healthy and glowing skin, and it reduces signs of aging. So again, you have to know how to choose your moisturizer. If you have oily skin, you have to choose a light one, oil-free, non-comedogenic moisturizer. And if you have dry skin, you have to aim for a heavier oil-based moisturizer. And the last one, the last and most important item in your skincare routine is actually the sunscreen. So you probably all know that sun exposure increases the risk of cancer. And UV rays are actually responsible of up to 80% of the visible signs of aging, including pigmentation, dark spots, and wrinkles. So that's why we as dermatologists recommend the daily use of sunscreen all year round and not only in the summer.
Okay, yeah, I'm glad you say that because a lot of people think that, oh, I'm only going to wear sunscreen when I'm going to the beach. So it's good to know that, no, every day, no matter, even in December, January, you still need your sunscreen.
It's important to use a sunscreen daily of SPF 30. And if you're going to go in the sun, you use an SPF 50.
Okay, so 30 is if you're staying indoors mostly, but 50 is if you're actually spending the day in the sun.
Yes, it's true.
Okay. As a doctor, what do you see are the most common skin conditions?
So in my practice in the UAE, we usually treat a lot of skin conditions related to skin, hair, and nails. It can be from eczema, dry skin, acne, rosacea, some types of infections, fungal and bacterial infections, wart that we see a lot in kids, some skin conditions like rosacea and psoriasis. And we treat as well skin cancer, some skin growth, and moles. And we do a lot of procedures as well, such as cryotherapy and skin biopsies, and definitely some anti-aging treatments and anti-aging procedures, such as filler, Botox, mesotherapy, PRP, and a lot of lasers.
But that's usually for beauty, like for beauty purposes, not for treatments, am I right? Or do you use cryotherapy or even Botox for treatments of conditions?
So actually cryotherapy is we use it mainly for medical purposes, like for warts, precancerous lesions, and even laser can be used sometimes for medical purposes, such as rosacea, or treating veins, or broken capillaries, or treating precancerous lesions. So we definitely have a lot of equipments and tools to treat medical things and aesthetic things.
I mean, thank you so much for saying that, because like I said, there's just this misconception that, it's always fillers, Botox, or cryotherapy. It's all for beauty purposes or aesthetic purposes, but no one actually knows that they can be used to treat actual skin conditions.
Skin disease.
Yeah, okay. Is there a difference between common conditions affecting males and females, or between different age groups?
So definitely there's a difference. So if you want to talk about gender differences, so females are usually more prone to have conditions related to hormonal changes like melasma and acne, for example, during menstruation and pregnancy and even after menopause. And generally, we noticed worldwide that females are more prone to autoimmune or inflammatory skin disease like lupus and scleroderma, while males, they seem to be more affected by psoriasis, some types of skin cancers, and seborrheic dermatitis. So if you want to talk about age differences in skin disease, usually in kids, in children, we see a lot of eczema, skin issues related to dry skin, diaper rash, for example. Those are mainly seen in infants and toddlers. In older children, we can see warts. In adolescents, the most common complaint is acne. In adults, skin conditions like psoriasis and rosacea tend to appear, and women can have pigmentation, for example. And in older adults, we can see skin cancer and precancerous lesions.
You say there is a lot of eczema, warts, rosacea, and psoriasis right now. Is there a reason that it's increasing, or has it always been the case?
Yeah, so the studies showed that usually, and statistics have showed that they are usually the most common skin disease worldwide. So there's no reason that they're actually more frequent now, except in the UAE. You know, the weather doesn't help. So first the sun, then you have the air conditioning, the change in the weather, the difference in the temperature between outside and inside. That's why people here are more prone to skin allergies, to dryness, and to eczema, for example.
Is there a way to prevent that, or is it just like it's going to happen anyway, so let's just deal with it when it comes?
So definitely there's a way to try to control it. So moisturizing their skin and hydrating your skin is very important. So if you keep it hydrated, it would be less sensitive and less prone to allergies and to irritations.
Okay. Let's shift gears a little bit. So anti-aging products, do they actually work?
So to answer your question, you have to know how does the skin aging process happens. So you know when you age, the elastin and the collagen in your skin degrades, and the rate at which your skin cells turn over drops dramatically, and this can lead to wrinkles, loss of firmness, and sagging. Ideally, if you want an anti-aging cream to work, it has to slow down the collagen loss while speeding up the rejuvenated process of cell turnover. And to make things more complicated, there's definitely a lot of external factors that can affect how your skin ages, for example, or that can aggravate the skin aging. For example, smoking, diet, and sun exposure can influence how fast and how much your skin can age. And definitely your genetics usually influence if you're susceptible to these external factors. So overall, if you want to talk about an anti-aging product that actually works, first, we already said it should slow down the collagen loss. Two, it should be supported by clinical trials and research that actually works. Three, there's some other variables that are actually that affect the efficacy of these anti-aging products. For example, the individual skin type. So a product that works on your skin, for example, doesn't work on my skin. So it's very important to know how to choose and what to choose your skincare product. Okay. And lastly, the way you use it, if you use it consistently, actually affects the efficacy of the anti-aging skincare product.
Okay, you say it's important to know how to choose the product.
Yeah, so overall, the ingredient is important.
Yeah.
So choosing an effective ingredient and using it consistently in a comprehensive skincare routine. But at the end, as we said earlier, so the sunscreen is the most important anti-aging product in the market. So you have to use it daily.
Okay, so how do people understand their own skin type and what kind of product works best with them? Is it just trial and error, or is there a way for me to know, like, if I have oily skin, then I should use this. If I have dry skin, if I should use this.
So first, you have to research the ingredients. You have to know. You have to know what are the ingredients. You know, what are the most common ingredients. What are their benefits and their side effects. You have to test the product on your skin before fully committing. You can read some reviews, some testimonials, and be skeptical of some buzzwords like anti-aging, instant, miracle. Those are more about marketing than science. And lastly, you can consult your dermatologist. Usually they know what would be the best for you, and they can advise like personalized recommendation depending on your skin type.
Okay, so you're saying there are different active ingredients, and I think there is this sudden hype and all these new things that are just being thrown around. There's hyaluronic acid, there's glycolic acid, there's salicylic acid, I think. So, which, actually, I always thought that acid is bad for your skin because it can burn your skin is what I was taught in school, but suddenly we're looking for acids to put on our skin. It's just very confusing. So can you maybe walk us through what type of active ingredient is used for what purpose?
Okay, so first, hyaluronic acid, it's a natural substance that you find it in your skin, naturally in your skin, and you can find it in the joints and the eyes.
Didn't know that
So-
actually.
Yes.
Okay.
So what's remarkable about this substance is that it can attract around 1,000 times its weight in water. So imagine if you have a quarter teaspoon of hyaluronic acid, it can hold a half a gallon of water.
Okay.
And due to this moisturizing properties, it's usually used, it's usually used widely in cosmetics. So it can be found in serums, in moisturizing creams, in fillers, and in skin boosters, for
You
example.
mean cleansers? I think there's now cleansers with
Yeah,
hyaluronic
if you want
acid.
the hydrating effect, you
Oh.
can you can have the hyaluronic acid in combination of other ingredients. Okay, so it's proven scientifically that hyaluronic acid reduces sign of aging. It can work on dilated pores, fine wrinkles, and it stimulates collagen production.
What other kind of acid or non-acid, like what kind of other active ingredient is like really effective? So I think retinol is also one of the famous ones.
So glycolic acid actually is used to exfoliate the skin, to remove the dead skin cells from the surface of the skin, and this will gives you, a more even skin tone, a smoother texture, and has an anti-aging effect as well. It's better to use it in the evening because it can make your skin sensitive, and it's suitable for all types of skin. While salicylic acid is more effective for oily skin and is used in acne-prone skin and oily skin because it reduces oil production. It can work on blackheads and whiteheads. So there's definitely a difference between both of them.
All right. There are some other things, some other active ingredients also, like peptides, AHAs and BHAs. I think these are also one of the common ones that I don't know what they are.
So we already mentioned some types of AHA and BHA. So AHA means alpha hydroxy acid, and glycolic acid is the most common AHA that we know.
Oh,
Okay.
glycolic acid is a type of AHA.
True, and salicylic acid is a type of BHA. And those
Really?
all of them are exfoliants, and they exfoliate the skin. But each ingredient work in a different way and have different actions, and you can use them in, different purposes and for different skin types.
It's like a light bulb just went in my head. I didn't know that, I didn't know they're essentially the same thing, or that glycolic acid is a type of AHA and salicylic acid is a type of BHA, because different titles and different descriptions say like this is your AHA, BHA, and then someone else, some other company or other brand uses glycolic acid or salicylic
That's
acid.
true.
I thought they were different things. I think
Yeah,
so
but
many people have that misconception though.
Now, usually when they mention AHAs, maybe it's a combination. Or you have other types of AHA like lactic acid, citric acid. Lactic acid gives you some hydration, for example. Mandelic acid works on pigmentation. So possibly when they mention AHAs, it's not only glycolic acid.
Okay, good to know. Does someone actually need all of these active ingredients, or is it like depending on your condition or your skin?
So like I said before, so you usually, when you have an imperfection or a skin concern, we as dermatologists, we can combine these ingredients in different combinations and different concentrations depending on your skin type and your concerns or your skin imperfection. For example, if you want to tackle acne, you can use tretinoin, which is a type of retinoids. You can combine with it vitamin C to work on acne marks. You can combine AHA mainly salicylic acid, BHAs.
Okay.
Salicylic acid, and you can use niacinamide, which has a calming effect and anti-inflammatory effect. If you want to focus more on the anti-aging effect, if you want to work on the pores, dilated pores, on the wrinkles, on the fine lines, we usually give higher concentrations of retinoids, hyaluronic acid, vitamin C as well, and niacinamide.
Okay, so not everyone needs everything. You should please visit a dermatologist and they will tell you what you need, because it's not, I think there's also a risk to kind of combining things with each other. Maybe some active ingredients don't work well with each other.
Yeah, it's true. So, for example, retinoids and AHAs, for example, both of them, they make your skin sensitive and they make your skin dry. So it's better in the beginning to alternate and not use them at the same time. And even when using retinoids, it's better to use it progressively. So every other day, check how your skin reacts to it, if your skin is sensitive, if you have any reaction, and then you can use it daily.
Okay, let's talk about hair for a bit. What are the most common complaints or conditions that people come to you about their hair? Hair loss, I imagine?
Yeah, it's the most common complaints, usually hair loss, but we can see other types of hair issues like excess oiliness or dryness. We can see dandruff, seborrheic dermatitis, some allergies and scalp conditions like psoriasis again, some types of fungal infections and bacterial infections, and change in the texture of the hair. So if the hair becomes more frizzy, or brittle, and usually this is related to chemical damage.
Okay, so what is an effective treatment for hair loss, since it seems to be following everyone starting 30 and above?
Okay, so first, if you want to treat your hair loss, you have to know what's the underlying condition, or if there's any underlying condition, like such as thyroid disorders, vitamin deficiency, or other skin conditions like alopecia areata. And when you have these conditions, you have to consult your dermatologist. If you want some tips to prevent hair loss or to treat your hair loss, first, try to avoid washing your hair daily. If you have oily scalp, you can wash your hair every 2 days. If you have dry scalp, you can wash it 2 to 3 times per week. And always use a sulfate-free shampoo. Try to avoid all the heating tools like flat irons, the hair dryers, and the curling irons, and try to avoid chemical treatments or to limit them, such as Botox or keratin, and coloring your hair and perming.
Okay, all right. I'm gonna ask you a question about Korean skincare. It seems to be all the hype these days. It's just everywhere. It's like this serum or this cleanser or all these things that fall under the category of Korean skincare. Is there a reason for this hype, or it's just because it's the new trend?
So actually, definitely, social media played a big role in their popularity. You know, the hashtag glass skin, probably heard about it. It's a trendy hashtag in TikTok and Instagram.
Yeah.
And it refers to a healthy, glowing skin like glass without any blemishes and pores. And everybody wants this.
Of course.
Of course. And the Korean brands are known so Korean brands are known for using natural and unique ingredients like snail mucin, propolis, and tea extract, green tea extract, for example. And this is very unique. So Korean brands focus usually on your skin health. So instead of covering your skin with makeup and your infection with makeup, they emphasize on having glowing and healthy skin. So they come in attractive packaging and nice designs, which makes the experience more fun and engaging. And they're more affordable than other products. That's why they're more accessible.
Okay.
So
Yeah.
overall, if you want innovative ingredients, effective marketing, and even cultural influence, this is what makes them more popular than other.
Yeah, I mean, there's also the rise of just K-pop culture and Korean drama and everything. So I think there's just the focus now is Korea, everything Korea.
It's true.
And, you know, just to honor the title of this episode, what would you say is the ultimate skincare guide or routine for daytime and for nighttime?
So in the morning, the first step would be to be the cleansing, to wash your face. The second step would be to use a toner. It's optional. Third step would be to use the serums. It's preferable to use an antioxidant serum like vitamin C to protect you from the sun. Then you can use an eye cream. It's preferable to use it in the morning and in the evening. Then all the target treatments, for example, for acne, you can use them after the eye cream, like topical antibiotics and benzoyl peroxide. Then moisturize, and then SPF. And ideally, you can combine the last two steps. You can use a moisturizer with SPF 30, and then if you're gonna go to the sun, you can use the SPF 50.
And for the people who wake up very early and will probably not maybe have time to go through all the steps.
3 steps.
Yeah, so if you can, like, maybe you said cleanse, toner, and then a serum, eye cream, moisturizer, and sunscreen. So that's 6 steps. Can we maybe like shrink them a
Simplify
bit?
them?
Yes.
So if you don't have any imperfection or any medical issue, so clean your face, use a serum, moisturizer with SPF.
Okay, great, perfect. That I can do. Personally, I can't do a 7-step morning routine. Night I can.
Okay.
So what about a nighttime routine?
So at night, it's good to double cleanse because first you can use a makeup remover and then use a water-based face wash to remove the dirt and the oil. Okay. Then step 2, 3, and 4 are the same: toner, serum, eye cream. Then after the eye cream, all the treatments, the harsh treatments, and the good ingredients like retinol, exfoliants, AHA, BHA, all this are applied after the eye serum, and in the end, it's a moisturizer.
Okay, so the strong active ingredients, let's keep that for the night. I think you mentioned they make your skin sensitive, so it's not ideal to put them and then go out in the sun, right?
Sure.
Okay, perfect. Any other tips or advice you have for us?
Okay, so drink a good amount of water to keep your skin and yourself hydrated. Exercise, have a healthy and well-balanced diet, sleep well, between 7 to 8 hours per day, and don't forget your sunscreen and protect your lips as well.
Okay, perfect. Thank you so much, Dr. Maya, for being with us today. I mean, this was a very interesting and educational episode, and I think I'm going to go back and listen to it with like a notepad to write everything you said. So thank you so much.
Thank you for having me.
Our next episode is about the common cancers between men, so prostate cancer, colorectal cancer, and others as well. So please, for all the gentlemen out there, make sure you tune in. We're available on all platforms: YouTube, YouTube Music, Spotify, Apple Podcasts, Anghami, and Amazon Music. Stay well and keep thriving.